All right, today we're going to teach you about fall prevention. Some objectives of this presentation are to educate the senior citizen population, specifically those over 65, in regards to why this is so important, the risks of falling, what to do if you fall, home modification for fall prevention, and exercises for fall prevention. Why is this topic important? Falls are the most common cause of injuries and hospital admissions for people 65 and older. 3.7 million adults report having a fall each year. Of those falls, 2.2 million lead to hospital stays averaging 11.6 days. Major consequences of falls include fractures, brain injury, and loss of confidence and independence. The most common type of fracture is the hip fracture. 250,000 seniors are hospitalized for hip fractures each year. One hip fracture increases your risk of falling again. Falls are the most common cause of brain injury in older adults. They can have severe psychological impacts on life as well. After a fall, you become fearful, you avoid activities that you once enjoyed, which can lead to unhappiness, lack of independence, and depression, and it becomes a vicious cycle.
Okay, so what are risks for falling? Some of the internal risks for fallings may be a decrease in your balance. You may be at risk for a fall if you have leg or foot pain, possibly causing you to limp. If you're over the age of 65, if you've had a previous fall in the past, if you have weakness in your legs or hip, if you have poor eyesight, if you have a heart disease causing changes in blood pressure, or if you're on various medications such as sedatives, maybe corticosteroids, cardiac medications, antihypertensive medications, and hypoglycemic medications. Some of the external risks for falling are uneven floors or room transfers, cracks in the sidewalks or high curbs, lots of stairs inside the home or outside the community, low furniture such as coffee tables, chairs, or couches, slippery area rugs, a messy house, clutter on the floor such as grandkids' toys, extension cords, or even a pet running around, a slippery bathtub or shower without any grab bars to hold on to, no handrails on the stairs, inside or outside, a low toilet seat, or again, medications.
So what do you all? Number 1, relax, take 3 deep breaths, and determine if you're injured. Number 2, if you're okay, roll over onto your side. Number 3, get onto your hands and knees. Number 4, crawl to a sturdy and low surface such as a chair. 5, hold on to the chair and place one foot flat on the floor. 6, bring the other foot up onto the ground. And number 7, slowly bring yourself up to sit on the chair. And now we're going to watch a short video detailing what to do if you fall.
Firstly, don't panic. Check you're not hurt. Are you in pain? Can you move your arms and legs? Don't move if you feel pain. Try to summon help instead. If you are unhurt, try to get yourself up. Move onto your hands and knees and crawl to somewhere where you can pull yourself up, like a sturdy chair or bed. Put your hands on the chair or bed and bring one leg up, bending your knee and placing your foot flat on the floor. Lean forwards, pushing with your hands, and bring your other foot up so that it is also flat on the floor. Turn and sit on the furniture slowly.
Okay, so what can you do to prevent falls? First and foremost, speak to your doctor or physical therapist if you have any concerns. Talk to your doctor about medication use. Be aware of their side effects, such as loss of balance or incoordination. Number 2, as we spoke about earlier, I'm going to speak about later, home modifications. 3, you want to increase the strength in your legs to give you a stronger base of support. Number 4, you want to be aware of your surroundings. And 5, very important, never be afraid to ask for help. All right, so home modifications. A couple things you can do is tack any loose carpets or get rid of them completely. You want to have adequate lighting in rooms. Make sure the light switches are near the entrance. Get rid of any mess or clutter. Again, clean up after those grandkids. Watch for any wires or loose lines. You want to have handrails on both sides of the stairs. Install handrails near the toilet or tub. Makes it much easier and safer to lower your body down. Have non-skid mats in the bathtub and shower. You want to have elevated toilet seats. The furniture should be around adequate heights, not too low, not too high. And put grips and contrast tape on stairs that may become slippery.
All right. So now that you've modified your home, we want to talk about exercises that you can do that can prevent loss of balance and strengthen your legs. So we could do simple things such as squats or standing up and sitting down in a chair. We could also perform something called a tandem stance, which is just simply having one foot in front of the other and trying to hold that position for an extended period of time. We could also do marching in place, which is similar to walking, and you're shifting your weight as you march in place, which is very important for balance. We could work on bridges, which the person in the picture is doing with the white shorts and the black shirt. That works on the muscles around your hips, which are very important for balance. In addition to bridges, we could do something called a clamshell, where you lay on your side and you open up your legs, like the gentleman's doing in the red shirt. And something else called a ball or a towel squeeze, while you lay on your back and you squeeze a ball or a towel between your legs. All of these exercises target specific muscles that you need to use to have good balance and good strength in your lower extremities. So just to recap what our presentation has been about, first and foremost, we want everybody to realize that falls are a major health hazard in the senior citizen population. They are very serious. These falls can lead to a lot of other things that could lead to hospital stays, such from fractures, head injuries, and psychological impacts that could lead to depression and loss of confidence. It's very important for the senior citizen population to know external and internal risk factors that could cause falls. Now, if you know those factors, it will be easier for you to prevent falls, especially with home modifications and making your house as safe as possible. And you always want to be aware of your surrounding and risks. And the biggest thing is, don't be afraid to talk to your doctor or physical therapist if you don't know what to do. They are always there to help out. And the main thing is, we just want you to know what to do if you do fall. Thank you for listening to our presentation, and hopefully this will prevent falls. Thank you.